All right. Good morning, everyone. My name is Allie Wells. I am the Communications Director for the Foundation for a Healthy Kentucky. Thank you for joining Health for a Change, Medical Cannabis, and Community Partnership Opportunities. We've got a really great panel joining us today. We're all really excited about it. I'm going to turn things over to them in just a minute, but first, some quick housekeeping notes. If you have any questions during the webinar, you can put them in the chat or the Q&A box. There are no pre-approved CE credits attached to this webinar. However, I can provide a certificate of attendance for joining the webinar today. My email is up on your screen right now. If you want that certificate, please email me either this afternoon or next week. The subject line should say request for certificate of attendance, and then the body of your email just needs to say your name. And I will also include these instructions in a follow-up email after the webinar. A little bit about the Foundation for a Healthy Kentucky. We are a nonprofit organization funded by an endowment that aims to transform our state so that every Kentuckian has what they need to live a healthy life. Our mission is addressing the unmet health needs of Kentuckians, and our two focus areas are access to care and children's health. We do our work through policy advocacy, we build partnerships and bring together constituency groups, we fund research and data, and we fund and support community interventions and projects to improve the health of Kentuckians. This webinar today is a little bit of a closing the circle moment for us. In 2019, our Howard L. Boast Memorial Health Policy Forum focused on medical cannabis. It brought together stakeholders from across the state to give them public health insights and data on policy issues around medical marijuana. Fast forward to here we are today. At the beginning of this year, Kentucky started handing out medical cannabis cards to qualifying residents. But who is eligible and what is their first step? That's what our panel is going to dig into today. So with that, I'm going to hand things over to Sarah.
Hey, everyone. First, thank you to the Foundation for Healthy Kentucky and Allie for organizing this panel today. We hope it will be informative. If anybody in the audience has questions, I'm going to ask a few of our panelists first, but then want to answer what it is you all want to hear about. So please put those in the chat, and I'll be happy to get to those in a few minutes. For some short introductions of our panelists, first on my screen, we have Rachel Roberts. And if you ask me to describe her at any point in time, I think the best thing I could tell you is she's a Renaissance woman. She has a background in marketing and strategy. She has run multiple small businesses. She is a world traveler and teaches yoga in her limited free time. She also had the honor, pleasure, or maybe just simply responsibility of serving in Kentucky's General Assembly for 4 years, where she was also a member of the Democratic leadership team. During that time, she was a champion for medical marijuana legislation, including leading the bipartisan effort that ultimately led us to what we have today and what we're seeing at the Office of Medical Cannabis. She became the first executive director of the Kentucky Cannabis Industry Alliance, which you will hear us call the Alliance or KCIA on this call for easy use, in December. And the KCIA is the leading voice for both licensees, businesses, and practitioners in the state and in the medical marijuana state, and partnering with the Office of Medical Cannabis to make sure this program gets off the ground running and that patients get the access to the care that they've been seeking here in Kentucky for a long time. Next on our panel is Cannon Armstrong. He is the second ever executive director of the Kentucky Office of Medical Cannabis, and he took the reins officially just at the beginning of June, though he has been working with the team at OMC since the early spring to see the continuation of this program. Last fall, we really saw the start of it with the lottery that led to businesses and the beginning of this program. And now we're moving into the phase where the businesses are being developed, and we hope to have product on the shelves for patients by the end of this year. Previously, Cannon served as the Director of Charitable Gaming, the Director of Human Resources for the Tourism, Arts, and Heritage Cabinet. He also has experience as a practiced attorney and a business owner himself. And all of that leads to an extensive regulatory background that makes him very well suited to take over the executive director job at OMC. So we are really looking forward to seeing what the program will do under his leadership. Our next panelist is Casey Flippo, who is the Chief Executive Officer of Gold Leaf Management, a cannabis operations and consulting firm dedicated to helping license holders build sustainable, compliant, and community-focused businesses in emerging markets. He and his business partners live and reside in Arkansas, but are spending a whole lot of time in Kentucky these days. As we work to get the program here off the ground, they have background in all levels of this business, whether it's cultivator, processing, and the retail side. And he has been a huge asset to a lot of the licensees here in Kentucky. So we look forward to hearing a little bit about what he's seen around the country in the states where programs have started successfully, and some of the places where there have been issues that we hope to avoid here in Kentucky. Finally, last but definitely not least, we have Dr. Gabrielle Morris, who has 30 years of medical experience with degrees in chemistry from West Virginia University and a doctor of medicine from Marshall University. She's board certified by the American Board of Neurological Surgeons. She's a first generation American born to Hungarian immigrants. She is a longtime proponent of medical marijuana, going back to 1996 and California's Prop 215, which first legalized medical marijuana for patients. So we look forward to the expertise that this group can bring today. Rachel, I'm going to start with you. As Allie said earlier, the last time that the Foundation for Healthy Kentucky did an update was in 2019, not too long after the 2018 Farm Bill. We've come a long way here in Kentucky, and you have definitely lived that experience. Can you just help us kind of understand how Kentucky got to where we are here in June of 2025?
Yeah, thank you so much. I'm really happy to be here today, and hello to everyone who is viewing. So I served, Sarah. I don't mean to correct you, but it was 5 years, and they were all dog years. So I'm gonna take the full length of it. But every year that I was there, we had a medical cannabis bill that came up through the House, and it was always a bipartisan effort. This was always going to have to be a bipartisan effort, and we could get it through the House, but we couldn't get it through the Senate. So some of the people who really worked on this, you can go all the way back to Gatewood Galbraith, but House Majority Whip Jason Nemes and then Senator West this year, to get this through, took a different approach. So instead of having it start in the House, they decided to have it start in the Senate, because the Senate was always the hang up for getting this bill all the way through. And that's how it finally passed. But the truth of the matter is that the reason we have this is because of patient advocates in the state who stayed strong and dedicated, who did a fantastic job of advocating and really lobbying for this, and who made sure that lawmakers on both sides of the aisle knew who would benefit from this and how important it was. That said, we are late to the party. We are the 38th state in the nation, which has its pluses and minuses, right? Obviously, our patients have been waiting too long for this medicine, but because we are so late, we can look to other states and see where they have succeeded, where they have had challenges. I think that Cannon may talk to how this was helpful to them setting up the program. So we had so many other operations and programs to look at as we built ours. But I think what's really important for everyone to know is that this was one of the rare times that we really had bipartisan support for something in the Kentucky General Assembly, and that it really happened because of patient advocacy.
Thanks, Rachel. Cannon, I'm going to pivot to you. You've only been the executive director for 2 months. Welcome to the team. But in those 2 months in office, can you tell us a little bit about what you're seeing at this stage in the program? And can you tell us a little bit of OMC's goals for the programs in the next few years?
Yeah, well, first off, thanks for having me, everybody. I know that I'm probably a new face to a lot of folks who have been tuning into this type of information. I'm very happy to be here. It's been a ton of information, as anyone would expect. Sam Flynn, the previous executive director, and the team there at OMC, they've been rolling with this for almost a year, and they did an incredible job getting this rolled out and going through the license process. They pulled, like Rachel was saying, they looked at a ton of other states, and how they rolled this out and what they did. So whenever I was getting ready to come on, it was apparent to me that I had a lot of catching up to do in regards to all that information. So as you can imagine, previously experience in regulation, done a lot of that with charitable gaming and a large licensee group. Here we're dealing with 81 licensees, which doesn't sound like a lot, but it is a lot in regards to what these licensees have to do. Right now We're looking at just over 15,000 certifications for our qualifying conditions and what the practitioners have issued so far. We're almost at 11,000 card holders in the state. So getting up to speed on all that in a very, very short time has been a lot, but because like you said, I've really been in this role on my own for 13 days at this point. So that was daunting, but I really feel like Sam and the team at OMC really put me in a good spot in order to take something that's now been at a point of, building. And now we're at the point of actually applying what we built and trying to get this program launched and medical cannabis on the shelf. That's kind of where we are at this point. We're still working through licensee issues. Our website, from what I've been told by other states and licensees and practitioners and card holders, is very informative and is full of forms and how-to guides. If there has been an issue, there is a good chance that there is a technical advisory or there is a how-to form or some sort of information posted on that website to help people navigate any problems or issues or questions they have. So anytime I get a chance to speak, I always say, start there, because there's a good chance that that question has been reviewed and looked at and posted to our website. That's what we've tried to do in the rollout here, is to provide just an abundance of information on that website so people can actually go to it and see it and review it and think about it and look at it. As far as the goals for the administration, at this point is getting medical cannabis on the shelf, is doing everything we can to make this program accessible, make it successful, make sure that, our licensees are in a good position to be successful with what it is they're doing, whether it's a cultivation or a dispensary or processing or testing. We're working through all those different licensing groups to make sure that they're set up for success so that this medicine can actually get out there to the card holders that are there. So I would say that is the goal at this point. I am focused, laser focused on that particular goal. As far as doing anything else, and as far as larger goals, it's more about focusing on getting this on the shelf and getting this ready to go for Kentucky.
I think we have a decent number of providers on the call. So what are the important things they can do to be part of a successful program?
Well, the first thing is that, go to the website, get up to speed on where we are at this point. It's like review that, look at it, understand, what information's out there. For practitioners, it's like we've been very hands-on. We have a contact us page, which is monitored every day. We have a hotline, which is out there for questions. We respond to everything, whether in writing or through a phone call. I always say if someone has a question, whether it's a practitioner or a card holder, use that resource. It's rare in this day and age where you're actually going to get a person on the phone. So that our office is set up to do that. So if that's a very preliminary thought that someone has in the middle of the day, throughout their day, practitioner wise, to look at something, and they have a question, they can pick up the phone and call us. We're trying to get as many practitioners as we can the information they need in order to get on board with writing this. We've dealt with a lot of situations where we're trying to essentially look at the authenticity of whether or not that practitioner is really focused on the health and well-being of the patient, or that it may be a group that's kind of posing or putting information out there that's not really something that would qualify them for actually administering that sort of healthcare. Because there are a lot of groups out there. If you've driven around, you'll see the billboards up, help get your card. A lot of those groups are not actually doing medical evaluations, and we've spent a lot of time combing through those and answering questions on those. And I know we'll probably get into some points on the executive order, which is out there in regards to before we get this program launched in medical cannabis in the state on the shelf. So we're really focused on education. I mean, that is the main goal for practitioners and card holders. So the more practitioners that we have, the more card holders that we can provide service to. So that's really our focus.
Great, thank you. Casey, if I pivot to you, you obviously have a lot of experience in other states, and you also plan to be a business owner here in Kentucky. So what do you think are the keys to a successful program?
Well, yes, as Cannon started, I just wanted to say I appreciate you guys having me on today. And a lot of what I'm going to say is going to mimic some of the foundation that he set. And it's really going to speak towards what I believe to be one of the more successful foundations of a program that I've seen across the United States. So Cannon briefly touched on the fact that there were 38 other states before, or excuse me, 37 other states before Kentucky brought his program online. And I can tell you as an operator and as someone that thoroughly assessed the program, bones, they did a phenomenal job at laying a foundation for success for operators, for patients, and frankly, for regulators to oversee the program and be able to get programmed information out to both operators, patients, practitioners, testing labs, and anyone in between. And that really is one of the biggest pieces of success in programs. You see time and time again across the U.S. You see these cannabis programs coming online, and frankly, the regulators, the regulatory wing of the program is vastly underfunded and frankly underprepared, ill-equipped to manage a robust program. And when you see that, it leads to chaos out of the gate. There's little to no information. No one knows which way is up. And I saw something the other day that most cannabis programs that come online take 2.5 years to be propped up. And speaking towards the foundation that's been laid here, I think that while I know that everyone would like for it to have been yesterday or 6 months ago, I can tell you that in my understanding of how operators are moving and how expeditiously everyone is moving towards that collective goal of product on the shelves, that is a testament to how the foundation has been laid here in Kentucky. As far as the keys to success, I mean, launching off of that foundation, the next piece is going to be collaborative effort, right? So from practitioner to operator to regulator to testing lab to patients, we're going to have to continue to keep that education at the forefront of the program. Access and affordability for patients is a vital key indicator of success. We can have as many patients that have been approved, but if they can't get to their medicine and if they can't afford their medicine, then it's all for naught. And that's where the operators collaborating with, the rest of the program is vitally important. And I really think that, the foundation has been laid for success here in Kentucky. I, for one, can speak on behalf of our group and say that we've been absolutely floored with the level of sophistication of both the OMC and the individuals that are set to oversee the program. It's just it truly is uncanny relative to how other cannabis markets come online. Speaking towards Rachel and the KCIA, I know that her organization is set to speak on behalf of operators, on behalf of patients, on behalf of practitioners, and she's going to really put a solid threshold in the program to where we can have a unified voice and we can ensure that we're all swimming in the same direction. So again, these are things and these are facets to markets that really don't develop in other state-based programs for years, and these are already in place well before the market even goes to launch. So I can't commend the OMC enough, Rachel and her team enough for what she's done, and then frankly all of the practitioners that have rushed to getting certification and have rushed to putting themselves out there on behalf of the patient population and ensuring that they are well educated on what patients can and should not expect on the onset of the program. It just truly has been a pleasure to work alongside everyone.
Dr. Morris, from a provider perspective, what have you seen as the biggest challenges to date, either on the provider side getting up and running or from the patients, since you have the most direct access on a daily basis to patients? I think you're still on mute, Dr. Morris. We can't hear you.
How is that? I have 3 different mutes. Am I off now? Okay. My apologies. Well, thank you for hosting us. Before we go to the negative, the downsides, let's look at the positive. From the medical standpoint, we have to realize cannabis is real medicine that helps a lot of patients. And in these years where it's been in the other 37 states, Duber has been as well in Kentucky. We started under Governor Beshear's first EO. There are a lot of patients in Kentucky that can benefit. And growing the program is only going to help more people, but it starts with science. The medicine is legit. You need physician leadership as the cornerstone of the program because there are a lot of products out there. That's why the 81 license holders, that's why Casey's team has a lot to offer. We need to teach the patients what works for them. So as far as diagnoses, that's kind of 20 plus conditions to now only 6. Fortunately, a couple of those 6 are generalized and can catch some of the others, but not all of them. So the most common patients, really chronic pain and PTSD are what I see the most, cancer patients as well. But one of the things that came off was glaucoma, which was one of the original indications. So one of the other things that's kind of a big hurdle now is that, you know, Kentucky has a lot of rural land and the majority of our patients do not live in the big cities. So under Governor Beshear's EO, we were able to do telemedicine appointments for 2 years. And now the first appointment has to be in person. So even patients who had been coming to us had to drive a great distance. And we made a campaign to go out and meet most of them. But those 2 things that changed from the EO to the first law, really, we've got to relook at those because I think that's how we're going to help more people get better care.
And you started to kind of reference this, but what are the best ways currently for a patient interested in getting a card to access the card? And what do they need to have to be prepared for that visit so they can get everything done in one stop?
Well, you have to be, you have to be a Kentucky resident with a qualifying medical condition, and you have to meet with the doctor. You have to have your face-to-face appointment with the provider. And basically, we will evaluate you. The best is if you have outside medical records confirming your diagnosis. But again, we're doctors, we're nurse practitioners, we're PAs, we evaluate you. Most patients generally have to fill out, just like any other doctor's office, you fill out a detailed questionnaire about your history, including specifically your medications and your allergies to medications, reactions as such. And then the difference between traditional medicine is we're going to focus a lot on this is patient-centric. What are your goals? You have this list of diagnoses, this list of medications, but why are you coming to the table? What is the symptom that's disrupting you, and how can we help you manage that?
Do they need to make sure they have an ID or a driver's license when they come, or is there anything else you need to have when you see them that they should be prepared to bring?
Well, again, medical records, driver's license. The driver's license is going to be crucial as well for getting the documents through the state government. There is a form to be notarized from the website, as Cannon mentioned. We print that up and have it there for our patients right away when we see them.
Do you usually have a
and-
notary at your office, or do they need to take it somewhere else?
Oh,
Can
we
you
don't
have it
a notary
notarized
at our office, but
Okay,
you can have it notarized at your bank will do it complimentary. But basically, there are 2 steps, and we focus on that when we make the patient appointments. There's the medical portion and the government portion, and we kind of prep them with that, the driver's license, the notarized form, et cetera, on the government part, and that there is a nominal fee to the government as well. because, you know, patients can get surprised by that if they don't know.
And Cannon, I would like, Dr. Morris just mentioned the EO, so I would like you to help us understand a little bit the differences between what's in the EO and the law, and any issues your office is expecting to arise out of that. And then the second question would be, could you speak to the second EO the governor has recently issued that will address folks who are getting a card right now and what it means for them next year?
Yeah, happy to. So the governor on November 15th had the EO of it was actually for 2022, but it has, what we're talking about is the actual qualifying conditions which are listed in that EO. It's a much more extensive sort of list of conditions which you're probably going to find in several other states that have a program. You know, it's going to include all the ones that we have, which are, you know, cancer, epilepsy, PTSD, multiple sclerosis, chronic pain, but it's also going to have a bunch of other ones in there. You know, that is in the EO. There's probably like 20 more on there, which range from like sickle cell anemia, Huntington's disease, glaucoma, like you mentioned. So it's a much more expansive list of conditions which are in effect at the moment. But, you know, and I'll say the legislature and everyone involved in this rollout did an incredible job, and in every facet of it. There's always going to be things that you can improve and things that you need to look at based upon how things actually play out. And I'm sure those things will be looked at and considered. But we have a much smaller set of qualifying conditions which will go into effect once there is medical cannabis on the shelf. And the governor has spoken that the EO, the essential pardon that is in place, will end, and we will be working under the law that was formatted for medical cannabis in Kentucky. So we'll be down to a much smaller list of qualifying conditions, which Dr. Morris talked on, and, you know, their practitioners are familiar with when they're writing these certifications, that they must fall under one of these 5 qualifying conditions. A couple of them are pretty broad. You know, chronic pain and PTSD are our most written certifications by far. So a lot of our certs are under those 2. In the future, you know, for the purposes of trying to expand the conditions, you know, we've looked at that. We've actually been not opposed to that. That's something that we do feel like will probably be something in the future that needs to happen. You know, there's been a couple of bills floated which look at trying to expand, but they really didn't get any traction. It's not something that we can do on our own as far as expanding those conditions. But it's something that certainly, once we see this market stabilize and understand what people are needing in regards to medical treatment and this medicine, that's something that we expect we'll definitely be talking about in the future. As for the second EO that the governor just did in May, that was to sort of respond to a lot of the concerns which we hear and we wanted to respond to. That was the reason that we spoke to the governor's office about it, and the governor was at, you know, a quick yes on trying to help card holders out there, because there is a nominal fee. It's $25. But the main reason was that they've had a card. A lot of these folks have had a card for, you know, since January 1st. You know, a lot of people immediately got on and went through the process, spent the money for the doctor's visit, spent the money for the application fee, which is $25. And then they had a card they couldn't really do anything with at that point. So we were like, okay, we need to try to help in any way we can. So the executive order essentially waives the fee. It's a small amount, we get that, and people will still have to be recertified when they go to reapply, more than likely, because the certification will only last for a year. So they'll have to go back and see the doctor again, but, you know, we're trying to alleviate anything that we have the power to alleviate, which is that $25 fee. So if you received a card in 2025, when you go to reapply in 2026, all those people who currently have a card in 2025 won't have to pay that fee. We'll be waiving it. So that was just a small thing that we could do, but we wanted to do it. And we hope that helps a little bit, because it isn't covered. You know, it's one of those things, you know, I've seen a question already pop up in regards to, you know, the cost of being a part of this program. You know, insurance is not going to cover this type of medicine at this particular point. So, you know, those sort of fees are still going to be out there. You know, those sort of costs are going to be out there. And I don't necessarily have an answer for how that would be uh, covered. You know, we still have the federal overlay. We still have a lot of hurdles that are outside of our control with that. So, but, you know, we try to do everything we can to make this program accessible for everyone. And that goes to another point that Dr. Morris was bringing up in regards to, you know, the in-person visits and essentially having to travel. You know, we've tried to put this information and set up these practitioners and even the dispensaries in a way to where there isn't any sort of access deserts, as it's been stated in the past by Sam and people at OMC. We try to make sure that they're actually something within an hour's distance for most. And in the bigger locations, obviously there's multiple practitioners and multiple dispensaries that'll be available. But, you know, Kentucky is a very rural place. I'm from a very rural town with one stoplight, so I understand that you've got to travel to the big city sometimes, but we're trying to make it as accessible as possible.
Thank you. And I didn't do a full introduction of myself, but I am the lobbyist for KCIA. So the government relations professional in me cannot miss this opportunity. To reiterate what Cannon said, it will take an act of the General Assembly to expand the diagnosis. This program got to be here because a lot of patient advocacy and family advocacy. So if you are a potential patient on the call that doesn't have a diagnosis that's under the 6 in the law right now, but had one under the expanded EO, or if you are a provider or a family member who cares about a patient, who cares about that, call your legislator, email your legislator, talk to Rachel or I about what KCIA's efforts will look like and how you can be involved in those, because it will take a group effort to convince the General Assembly that it does need to be expanded. And that will be an effort that we're undertaking, and we want anybody who wants to be a part of. So Cannon, can you also tell us a little bit about the products that are permissible here and kind of how that may compare to other states where people may be under the EO getting product now versus what will be available on the shelves here in the future in Kentucky?
Yeah, for Kentucky, we have on our website, all this information is on our website, but the products that are include for us in our program, edibles, of course, which is kind of one of the bigger focuses of our program, oils, tinctures, vapes, and raw plant material. One of the more controversial pieces that we've talked about in educational pieces is that, you know, this is different from other states. We're not an adult use program. We're not, you know, in a position where we want to see people on the street, you know, smoking raw plant material. Smoking is prohibited for obvious reasons, but there is a raw plant material component to what products are available. That can be used in a many different ways, whether it's for home cooking or other kind of applications with the raw plant material. But smoking is prohibited, and we're taking that very seriously with our education and everything we're doing in order to get that information out there. Because, you know, at this particular point, this is medicine. The purpose of this is for a medical program. So right now, those are the types. And registered card holders under 21 of age may not purchase or use the vaporizing products. That's in our law, and it's on the website. That information's there. We're requiring all raw plant materials packaged to be labeled not intended for consumption of smoking. There's all kinds of components which will relate to law enforcement and the dispensaries and other licensees which pertain to that, which getting that information out there so people understand that that is not a part of the program. So, but those particular products are the ones that will be available in the state. And like I said, it's a real focus on those products at this time.
And Dr. Morris, how do you, as the medical provider, because we recognize this as medicine, but the federal government doesn't or regulate it. So how do you make a recommendation to a patient? And then how does that get to a dispensary so they're getting the appropriate product? And then Casey, if you could follow up and talk about how a dispensary intersects with what the recommendation is that the patient's being in, to make sure they get what is the correct, or they're trying something that is the correct thing for their diagnosis. Dr. Morris, if you'll start us.
Well, the idea cannabis as medicine is a journey for the patient. It's real medicine. It's based on the endocannabinoid system, so we have receptors and neurochemistry in the brain. It is very different than just taking a pill. So there's a lot of information. Most of the appointment really should be focused on physician teaching the patient how to start this journey safely. What we write is a recommendation. It's not a true prescription. It's a recommendation. The card is a document. So basically, the private medical document, the treatment plan that I send the patient, is their unique footprint to start, or blueprint to start. What goes to the state is a much more generic, yes, the patient does meet the state, has a qualifying condition, has no contraindications to therapy, and I am comfortable or not comfortable with the range that the state permits a patient. We transmit that electronically, then the patient does their application. The state issues a card that the patient downloads, so it's just a small document, and then they take it to the dispensary. They are essentially allowed to buy whatever the dispensary sells, and that's part of the real medicine, that different patients respond based on their brain chemistry to different products. So no matter how much experience you have coming to the table on the front end as a patient, you're going to go through that journey. You're going to go to the dispensary. You're going to go back and forth and learn over time which products work for you. So it's a very different experience than a traditional pharmacy.
Yeah, and to echo Dr. Morris's point, I mean, at the dispensary level, I mean, it's really a two-pronged approach, right? So cultivators and processors, the two groups that are in charge of product creation in the program, obviously within the confines of the rules and regulations that are set forth by the program. It's up to them to provide dispensaries with a plethora of different mediums and different applications, to ensure that the variability of it, you know, ingestion or whatever the mechanism is of consuming the product, is in alignment with that patient's needs. So it kind of starts at the forefront of product development. Cannon kind of touched on, you know, the raw plant material, raw flower, which is kind of the flagship of a lot of programs. It is not meant for inhalation, and it is not meant for combustion here in the Kentucky program. So at the dispensary, from an education standpoint, Dr. Morris hit the nail on the head. It's going to be a very intimate relationship with between the practitioner, the patient, and then the dispensaries. Dispensaries are going to be challenged with keeping up and helping patients work through that journey that they're going through. I can speak towards things that we've done in the past at retail. We're huge advocates of patient journals, right? So one of the things that happens when a patient comes in talking about edibles, which Cannon mentioned was kind of the flagship product of the program. You know, edibles are going to digest in people's systems differently, no matter how experienced or inexperienced they are with cannabis use. So what we always try to encourage, obviously based off of the specific ailment that they are experiencing, is we call it low and slow, right? Like don't overconsume, don't put yourself in an adverse situation with this medicine. Just like many medicines, it can have some adverse effects, albeit less serious adverse effects than others. But we strongly encourage patients, especially patients that are inequipped or that maybe don't have as much experience using cannabis in the past, to really ease their way into the cannabis application that they see fit, and to use their patient journal that a lot of dispensaries will actually facilitate for them, and helping them, you know, mind map how that effect is either helping or hurting them, and whatever adverse reaction or whatever adverse effect is happening alongside that application. So It really is a journey. It's not really a one size fits all solution. And a lot of patients, especially early patients that don't have prior experience with cannabis use, are going to experience a little bit of, a trial and error effect as they're trying to dial in their appropriate dosing and as they're trying to dial in their appropriate medium of use. So we're here as, as industry professionals. I can tell you that, in getting to know a lot of the operators that I believe are going to be successful in the Kentucky marketplace. A lot of them are, going to bring a plethora of product selection for us at the dispensary level to use. And then it's going to be up to us to work alongside the doctors and the patients themselves in finding the best application of consumption.
Casey, you and Cannon have both referenced how Kentucky is working, both the licensees and the Office of Medical Cannabis are working very hard to get this program up and running very quickly, much faster than has occurred in other states. But for some patients who have been waiting years for this to be legal in Kentucky, and for some impatient people like me, I'm the problem, it's me, who want to understand why it's taking so long, why there isn't product on the shelf right now. That's my favorite thing to ask. When's the product going to be on the shelf? Everybody on the call just know I'm asking on your behalf on a daily basis. But can you explain the business process of what you're going through from when you were awarded a license to when you will actually have product on the shelf, so that people like me can maybe be a little more patient?
Yeah, I mean, and listen, you're not asking a question that anyone before you hasn't asked before. I promise you, these programs are, I mean, and I believe this fundamentally. I mean, first and foremost, I believe in this as a medicine. I believe this in an application to help thousands of people across the Commonwealth of Kentucky. And because of that, I understand the importance of getting product on the shelves more so than most, right? And I can tell you, as shepherds of the program and as shepherds of the foundation that's been laid before us with the OMC, everyone that I know that are participating in this program are taking that responsibility extremely seriously. And I think that I've heard the fable of you can have it fast, cheap, or good, right? Pick two. And unfortunately, when you're launching a cannabis program, cheap is not an option, right? And frankly, fast is not an option. And the reason being, and it's really important to understand, this kind of goes back to the earlier question regarding like other programs. The way that this program is set up as a medical program with the infrastructure that's already been laid out and the foundation that's already been laid, operators are coming in and investing sizable amounts of capital into this program. By my estimation, I would argue that once the program is at full bore, we'll probably be pushing somewhere close to $250 million in capital investment just in infrastructure. That has nothing to do with license transaction or anything like that. That's literally just infrastructure being put into place to ensure that the product that's being presented is of the utmost quality and consistency that it can possibly be. I understand. I understand the need to get the product on the shelves. I can assure you that relative to other programs, this program is going to launch in record time. I believe that the last licenses were issued sometime in December of last year. The program launched on January 1. And certainly for those 15,000 patients that have already been pre-certified, we acknowledge that those people are sitting there waiting in the wings. And we are working extremely diligently. But when you're talking about putting in, 115,000 square feet of canopy, which is the original allotted amount for the program, that's going to take some time. And that's really what we're experiencing right now, because the retail stores, realistically, that's going to be a standard application for the most part. There are going to be some hurdles from a regulatory perspective to ensure that, whatever is being put into place works in conjunction with municipal, county, and state officials. But outside of that, retail is something that can be somewhat expedited. The biggest hurdle to overcome is going to be at the actual product standpoint. So, It has to be cultivated before it can be processed. It has to be processed before it can be put into product. That product has to be tested before it can be put onto the shelves. It's just as simple as that. And I can tell you, and I can say this fairly with a reasonable amount of confidence, that I believe that before the end of this fiscal year, you will see product on the shelves in the Commonwealth of Kentucky, and patients will be able to access that product at a pretty high level.
Thank you. And Rachel, I want to get to audience questions here quickly, but I do also want you to tell the audience a little bit about KCIA, who you are, the goals, and how participants can get involved if they would like.
Thanks, Sarah. So KCIA was stood up to help support the industry, to make sure that the industry is behaving the way the industry should, to make sure that it has a chance to thrive here. And by thrive, I mean, so everybody who's making those kinds of huge investments that Casey was just talking about has a real chance to make their business work in Kentucky, so that they stay in Kentucky and they continue to provide quality, safe, and consistent product to the patients of Kentucky. So that's really what the Alliance was stood up for. There are associations, alliances in most states, and they all sort of operate under that same guideline of how do we help the industry, how do we sort of self-police the industry to make sure that everyone's doing what we need them to do in a safe and effective manner. What we did that was a little different, not every alliance does, is we invited medical practitioners in as well, because we know that doctors like Dr. Morris are the ones closest to the patients, and so they have a really, really unique and important voice that we feel really strongly needs to be part of that alliance. One of the reasons I wanted to have this opportunity to talk to a lot of people today is because we can help with some of that patient access. We're working with the Office of Medical Cannabis to figure out all of the ways that we can help, but for sure, what we can do is help provide medical providers for your health fairs or any place that you may be having pop-up medical services for patients all around the state. So if you are someone who helps put those on, please take our contact information. Please reach out to me. I will make certain that there is a medical provider who is there to serve those patients. You've heard the discussion, Cannon mentioned that this isn't covered by insurance. So make no mistake, there are some medical practitioners out there who are going to be bad faith actors in this, who are going to charge exorbitant amounts to patients. We won't partner with those doctors. So look for ones who are members of the Kentucky Cannabis Industry Alliance, like Dr. Morris and some of our other members already, who are, charging fair rates that they absolutely have to charge to be able to keep their practices open and based on their level of expertise. But there may be ways that KCIA can help to offset some of those costs for patients, and we can certainly help get physicians, practitioners to the patients where they are. And then I would just hope that people would use us as a resource. We have a weekly newsletter that we send out with industry updates that is free to anyone to sign up to get. We try to share information. We always share whatever Cannon's department is putting out as well. Sometimes their website is phenomenal, but sometimes it can be, there's so much information on there. We try to send out things that are really tailored to specific groups that might just make it a little bit easier for you to find if you don't spend as much time on their website as I do, for instance. So please just reach out, use us as a resource, and absolutely use us to help bring providers to patients in your area.
All right, we're going to jump into audience questions for a few minutes. And Rachel, you kind of alluded to this one, but I'll let you and Dr. Morris talk a little bit about what is the amount or fees that you have to pay kind of collectively, I think is the question, to get a card.
Well, I will tell you, at Duber, we're in 13 states. So when we come into a new state, we look at the range of what all the other providers are charging. And yes, we see exorbitant amounts and all kinds of schemes in all states. For example, where they might not give the patient a full year's card. And so we look at the range and we price right at the mean so that we can be generous with coupons. For example, our best coupon is for anyone that's a military veteran. So to try and offset those prices. So our price currently is at $145 for an initial visit. On the renewal, it drops to $120. And again, we send renewing patients coupon as an incentive before, so they don't let it expire. After that, there's a $25 fee with the state. I am not 100% certain, and maybe Rachel or Cannon could answer that, but Kentucky uses the same software, Tyler Industries, that other states do. And many states charge a processing fee on top of that $25. So for example, in another Duber state, it's $27.59. I don't know if it's a 25 even or not for patients. But those little things do matter to patients. You want to let them know, like I said, 2 parts to the card, medical and government, medical and regulatory. And, you know, they both have applications and things they have to fill out.
Just pop in on top of that and say, you know, Sarah did a great job of telling you why it's so important to lobby at the state level. We also need all of you to be advocates at the federal level. I've seen some of the questions in here about medical studies, and one of the biggest problems we have is the scheduling of this at the federal level and the lack of access to some studies that, you know, those of you in the medical profession are really used to having access to. So we need the federal government to reclassify this so that insurance can cover it, so that we aren't seeing, you know, these in large part are patients who really are economically disadvantaged. And for them, these are price barriers and hurdles. And we at the Alliance are really working on ways to try and eliminate some of that. But we need insurance to cover this medicine like they would cover any other medicine. So when you're making your list of phone calls every day, don't forget to keep our federal delegation in that list as well.
And Sarah, if you don't mind, I'd like to just speak on behalf of industry operators with that as well. We acknowledge the financial burden that it takes for families and individuals to participate in the program, and in large part, you know, there are certain regulatory considerations for us as operators to you know, lessen that burden or make things easier on those individuals as they're trying to get their card and go through the consulting process. Obviously, within the confines of those rules and regulations, I can speak towards a lot of the operations that I have experience with previously, and I don't want to dissuade obviously anyone that may be on a budget. I'm not trying to promote any pressures or anything like that, certainly before any product is available on the marketplace. But I can tell you that a lot of operators are very, very aware of the financial burden and very aware of that commitment that is being put forth by the individual patients. And for our operation specifically, we launch a number of efforts that are really not just for the initial engagement with patients, but also just that are reoccurring, right? So we have compassionate care programs that are going to be provided to people that, you know, qualify with special conditions and that need special assistance on affordable medicine. We're going to ensure that we are providing, you know, support and financial benefit to those to the best of our ability. That maybe, you know, that around $150 consulting fee is costing them on those initial visits. I think that there's a way for operators to help participate in lessening that burden when and if, you know, or excuse me, once product is on the market. So we are very well aware as operators that you know, that is a big commitment, and not being covered by insurance, that puts a burden and a strain on people's financial positions. And we want to do everything that we can. And I feel pretty confident speaking on behalf of the industry that we will do everything within the rules and regs that we possibly can to help lessen that burden.
Ken, you kind of touched on this earlier, but we have a question. Can any doctor set up their own card distribution office? And what's the process to become a provider in this space?
Sorry, I was on mute. So yeah, they could. Obviously, we don't actually license doctors. That's the board of medical that's the medical board that would actually license the doctors, and then you have the board of nursing, which will license those folks. As far as setting up that practice, that's not something that we really would provide guidance on. Once they have that once they follow through and got those licensures for the state, because what we've had is a lot of people who are practicing somewhere in another state, or they're asking to see patients in their state who are from Kentucky. You know, always our response is that, you know, obviously you need to be licensed. And then once you go to apply for as a practitioner, we would evaluate everybody's application based upon that. But you know, whenever they're writing and seeing these patients, it needs to be in the state. So I assume they could, but it's all case by case. Like when they apply, that's something that we evaluate and we check for. So
I can comment a little bit to that, because as a physician, yes, you can take the class, as Cannon said, and, you know, there are training prerequisites, take the course, fill out the application, and apply to your office. But the reality is that everything in medicine, malpractice insurance is required of us. We may not practice medicine without malpractice insurance. Traditional malpractice insurance, again, federal, state, traditional malpractice insurance does not cover you to do cannabis work. And so therefore you have to buy a separate policy. So for many physicians, it's a real hurdle if they work for a group or a large organization or a hospital system. It's not part of their insurance, and therefore the employer will prohibit them from doing that. So there are some logistics. And then again, if you have an office that you've already paid for, but your partners don't do that kind of work, now you've got to get another office. And so that's why, even though the 81 licenses for the dispensaries have resulted, it will prevent having a desert for shopping, there's not going to be the corresponding for the physicians, because we have different hoops we have to jump through to do this kind of work.
And staying with regulatory questions, is an incoming out-of-state 18-year-old college student with a history of a qualifying condition who has been successfully treated with medical cannabis in their home state required to apply in Kentucky? And are they able to if Kentucky is a temporary address? This person says they're specifically looking at 915 KAR 2010, section 11. So they know very specifically where they're looking to ask their question from. But in that scenario of a college student or someone here temporarily with a temporary Kentucky address, would they qualify?
Oh man, I wish I could just rattle off the exact answer to that, but I can't. But I will say that she can email us that particular question and I'll get her the right, or him the right advice. Obviously, getting a card here in the state, I think they could do that with the address that they have, which would help with any supporting documentation that they might have with bringing in medical cannabis from another state, which they're receiving. You have a certain limit, but rather than giving her a bad answer, I would like for them to email us and I will give her the exact answer that she needs in order to be prepared.
Perfect. And hopefully Allie can help us connect on that. Do we have time for one more question, Allie, or you want us to wrap up?
You can do one more.
Okay. Dr. Morris, there is a series of questions in here related to evaluating true pain and fabricated pain, distinguishing a patient with true PTSD versus someone who's just kind of repeating criteria they may have found on the internet or somewhere else. How, as a medical professional, are you looking to find the right patients where this is the treatment that they should be pursuing?
I did notice that whole group of questions. I did notice that whole group of questions in the thread, and I found them a little bit coming from a negative perspective. It's no different than doing your job as a physician every single day of the week. Every patient I meet, my job is to interview them to ascertain what is going on with the patient. Every patient, whether I meet them in the emergency room at 3 in the morning or 3 in the afternoon in my office, I need to figure out if they're telling the truth or telling a lie. I need to figure out what their medical condition is. I can't help them if I can't do that. So, you have to be a great doctor. And we do that every day in our jobs. I'm the one that has the pleasure to teach our new incoming physicians and nurse practitioners, MPAs. And that's what I remind them. Approach this like you would any other patient evaluation. The difference is that our job doesn't stop when we make the diagnosis. We have to confirm the qualifying conditions so they qualify, so they can enter this program. But our job as a physician, remember, doctors are teachers. We are to teach them how this medicine can help them, because I've seen thousands of patients get away from medicines that are much more harmful. So don't get hung up on the 1 or 2 people that have lied to you in the last month. How many patients come in your office every day and tell you the truth? That's the majority of the patients I encounter. And those few that are lying, we can tell, just like in any other office setting.
Well, thank you to all of our panelists for giving us an hour today. I hope the audience found this informative. Thank you to the Foundation for Healthy Kentucky. And if there are questions that you need answers to that we didn't get to today, please share them with Allie, and then Rachel and I will try to help facilitate getting you answers to all of those. Thanks, Allie.
Thank you. Yes, there will be a follow-up email with the recording from today if you want to go back and watch any parts, and I will have the appropriate contact information for getting connected with KCIA or the follow-up questions. So with that, have a great rest of your Friday, everyone, and have a great weekend. Thank you for joining us.
Thanks, everybody.
Thank you. And